Welcome, 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 everyone. My name is Dr. Kelly OMD. I am a board certified OBGYN as well as a healthcare executive. My goal is to educate, encourage, and inspire 1 million women to viva life, which means to live their healthy, wealthy life. So, that being said, I am going to introduce our guest. Actually, she's going to introduce herself. Her name is Dr. Priscilla H. We call her Dr. H, and she's from Lux Psychiatry. She's going to be focusing with us today on depression. Doctor, are you with us?
Yes, thank you so much for having me. I am so excited to have this conversation with you all. So just a quick introduction about me. I am Dr. Priscilla Hidalgo, or Dr. H, as my patients call me. I'm a board certified psychiatrist. I am also fellowship trained in geriatric and certified in geriatric psychiatry, but I focus more on the management of adults up to 65 years old, and particularly in women. And I also like a lot physician wellness. My private practice, Lux Psychiatry, was created as a way to allow more access to psychiatry to people. I describe myself as the psychiatrist who helps busy people feel less stressed and less overwhelmed and happier with life. The hours that I operate are usually on weekends or evenings, so that way it's more convenient for other people. One of the things I want to talk about today, as we talk about depression, is how depression can be different for some people. This is going to be a little bit more into that depression is not necessarily just sadness or feeling depressed one day, but what a depressive episode actually looks like and feels like. I also want to talk about how our menstrual cycles will also affect the way that we feel. And I want to talk a little bit about some of the things that we can do in order to kind of get started with treatment, and the things that you also can do in order to maintain the stability once you get there. So to start off, depression or a depressive episode is not simply just feeling sad one day. Usually people that experience a depressive episode, they experience depressed mood or low mood is the way sometimes they describe it. Your eating and appetite and also sleeping habits and patterns change all around. Sometimes people sleep too much or don't sleep at all. They feel tired during the day. They don't have the interest or the motivation to do a lot of things. Now, this is something that can look different for other people. For instance, children and adolescents, even though they may experience the depression, the way that we see it more is they seem to be more frustrated, more, angry with the world, kind of talking back and defiant, and also academic failures, which is one of the reasons why it's so important that whenever we're treating an adolescent or a child, that we include not only the family, but also the school. And as we start then menstruating, then we have another factor. So I think most of us are familiar with PMS, right? Premenstrual syndrome. Usually, there's some changes in your mood, maybe a little bit irritable, maybe appetite changes, maybe some bloating or pain, but it's usually not something that affects our day-to-day lives. So, we kind of think about it, at least 90% of women experience it, we live through it, right? Then you have a subset of people that already have a psychiatric disorder, let's say major depressive disorder or an anxiety disorder, that can experience an exacerbation of the symptoms in relationship to their menstrual cycle. So in the same way that PMS can occur the same, 5-7 days before menses actually begin, what these people experience is that throughout the month, they're already feeling like crap, or they feel very anxious. And then those days before their period, that gets definitely worse. And there is one of the things that we focus is not only on the treatment of the mood in relation to the menstrual cycle, but we have to kind of focus on everything, right? Then you also have a subset, even smaller, of women that experience PMDD, or premenstrual dysphoric disorder. This one is very circumscribed to those days before you get your period and things get really bad. It's not simply just PMSing, as people say it. This actually is that if you're having PMS and you're kind of feeling a little bit irritable, PMDD will make you kind of want to kill someone. joking, but you know what I mean? Like there's a lot of anger, perhaps depression gets even worse. They can experience worsening, like bloating and acne, increasing more the cravings for junk food, sweet things and all that. And it's very disruptive. For instance, I had a patient once who actually got reprimanded at work because of the outbursts that she was having. And this was in relationship to those days before her menses. Now, with all this, with PMS and PMDD, once the menses begin, it usually gets better. And PMS, people do well the rest of the month, and PMDD, they do well the rest of the month. And that's why we have to focus on figuring out exactly what is that the patient is dealing with, so we can implement the appropriate the appropriate treatment. Now, in terms of treatment, one of the things I was telling you about earlier was lifestyle changes, psychotherapy, and medication management. In terms of lifestyle changes, we recommend that if women have PMDD, PMS, that they try to reduce how much caffeine they consume, including alcohol and salt, those days before your menses. There is some evidence that if you have a diet rich in thiamine, vitamin B2, that also would help with symptoms of PMDD. In addition to that, of course, the basics are always important. Exercising, taking care of yourself, sleeping, all that. There are people that in addition to these lifestyle changes may need to get involved in psychotherapy and have to take medications. For instance, we know that children and adolescents respond better to treatment if you actually combine psychotherapy with medication management. Now, the only way to know which is that you actually need is to actually see a professional like myself, because we can conduct an evaluation and then we can look at all the symptoms and we can figure out if this is something that you actually could just take care with starting psychotherapy and close monitoring, or if it is something that in addition to psychotherapy, you may need to be on medications. One of the reasons why I want to make sure we understand this is because sometimes people find themselves starting psychotherapy, but then they're not able to get the gains from psychotherapy that they actually want or need. And that is because sometimes the symptoms are too severe and they need to be on medications in order for psychotherapy to be effective, right? Some people use herbal treatments or like over the counter. There is some evidence that St. John's wort could help with PMS, but not really with PMDD. At this point, there's really nothing that we know that in terms of supplements that could help with this. So we don't usually recommend that. We tend to do more of the lifestyle changes I mentioned earlier. And then in terms of medications, you have antidepressant medications. And depending on what you're treating, you and your doctor can decide if this is something that you need to take throughout the month or if you just need to take it after ovulation, or what we call the luteal phase. For some people, PMDD in particular, they can just take it in the luteal phase. Now, most of the people that I see will forget exactly when is it that they have to start it and stop it. And a lot of times they just take it throughout the month. But most of the people that I see usually have a comorbid psychiatric disorder. So we have to focus on treating not only the PMDD or the PME, but also treating the other comorbid psychiatric disorders. So with this, I hope this kind of gives you guys a bird's eye view of what depression might be like, and kind of what you can do about it.
Can you just tell us, how do we get in touch with you if we're interested in getting in touch with you?
Yes, you guys can just go to my website, www.lukepsychiatry.com. You can send me an email directly. My email is right there. I also have an Instagram account, Luke Psychiatry, like I said, Facebook, Luke Psychiatry, all to keep it very simple. And if you want to work with me, you can just click on new patient in my website, and then it will give you access to my calendar so you can book the appointment when it's most convenient for you.
All right. Thank you for being a part of the Viva Life experience. I'm Dr. Kelly MD, board certified OBGYN and healthcare executive. If you like what you heard, then please go ahead and like, share, and subscribe. The reason why is because we are trying to educate, encourage, and inspire 1 million people to live their healthiest and wealthiest life. And this is what we're bringing you. We're bringing you educational videos. We're bringing you podcasts. We are bringing you webinars with subject matter experts, including myself, about the topics that affect you the most. So go ahead, like, subscribe, and share. We are everywhere. Have a wonderful day. Viva Life.